Recent statements by Alexander Ginsberg, director of the Gamaleya Center for Epidemiology and Microbiology, revealed that developing an effective vaccine against hantavirus could take around a year and a half. This news has brought new attention to a virus that many people know very little about, even though it has existed in nature for many years. The main point is not that scientists are unable to develop a vaccine, but that the project faces challenges related to funding, high costs, and the limited expected market for this type of vaccine, because the number of global cases is not as large as with other viral diseases. Still, any new outbreak, especially when it happens in a closed environment or on board a ship, increases concern and pushes people to ask an important question. Is hantavirus a real danger, and could it become a wider threat? Recently, the outbreak reported on board the MV Hantavirus attracted wide attention after several infections and deaths were recorded during a trip that departed from Ushuaia toward the Canary Islands. News like this spreads quickly because it combines two factors that naturally frighten people: an unfamiliar virus and a closed space where people from different countries travel together. But it is important to understand the picture clearly, away from panic and exaggeration. Hantavirus is not like some respiratory viruses that spread easily between people through the air in public places. In most cases, transmission is linked to rodents, especially mice and rats, through contact with their urine, droppings, or saliva, or by inhaling contaminated dust in closed and poorly cleaned spaces. The real danger of hantavirus does not come from rapid human-to-human spread, but from the severity of the illness in some infected people. This virus can cause serious symptoms such as high fever, extreme fatigue, muscle pain, and breathing problems, and in some cases it can lead to complications affecting the lungs, kidneys, or heart. That is why it should not be underestimated, especially if symptoms appear after exposure to places that may be contaminated by rodents, such as old storage rooms, abandoned houses, farms, ships, or warehouses that have not been properly cleaned or monitored. According to the information circulating about the strain linked to this outbreak, the virus involved may be the Andes virus, one of the known hantavirus types found in South America. This particular strain draws scientific attention because it may be capable of limited person-to-person transmission under certain conditions, especially when there is close and prolonged contact with an infected person. But the phrase limited transmission is very important here because it means the general public risk remains low, and the virus does not usually spread easily in the community like influenza or COVID. So the subject should be taken seriously, but without exaggeration or fear spreading. What makes developing a hantavirus vaccine complicated is that this virus is not just one type, but a group of different strains. Ginsberg indicated that an ideal vaccine should cover between 5 and 7 strains of the virus, and this increases the difficulty of research and testing. Scientists may also use technologies previously applied in some viral vaccines, such as virus-like particle technology, a method that helps the body recognize the virus without using a live virus capable of causing disease. This idea appears promising, but it still needs studies, funding, and safety and effectiveness testing before it can become a vaccine available to the public. But why is there still no widely used vaccine if the virus can be dangerous? The answer is linked to numbers and health economics. Hantaviruses cause thousands of infections around the world every year, but the cases are often connected to specific regions or special conditions. Since the expected market for a vaccine is limited, companies and funders may not see it as a commercial priority compared with vaccines for diseases that affect millions of people each year. This creates a dangerous gap between scientific need and economic interest. That is why, whenever a new outbreak occurs, calls return for more research support, because prevention in these situations can save lives, even if the overall number of cases is lower than with other diseases. It is also important to distinguish between individual risk and global risk. On the global level, there is currently no solid evidence that hantavirus is about to become a worldwide pandemic. Its transmission is usually linked to specific environmental conditions, the presence of rodents, and direct exposure to their waste. But on the individual level, the risk can be serious if a person is exposed to enough contamination and does not recognize the early symptoms. That is why prevention remains the most important line of defense, especially during travel, in rural areas, in storage spaces, and in closed places where rodent traces may exist. Prevention does not require complicated measures, but it does require awareness. Places that may contain rodent droppings should not be swept dry, because that can lift contaminated dust into the air. It is better to ventilate the area, use appropriate disinfectants, wear gloves, and avoid touching droppings directly. Food should also be stored in sealed containers. Holes that allow rodents to enter should be closed, and waste should be disposed of safely. On ships, in camps, and in remote tourist areas, these steps become even more important because the presence of rodents in a closed space may increase the chance of exposure. As for symptoms, people should pay attention if they develop sudden fever, severe muscle pain, unusual fatigue, shortness of breath, dizziness, or rapid worsening after possible exposure to rodents. In that situation, it is not wise to rely only on home remedies or to wait too long. Medical care should be sought quickly, and the doctor should be told about any possible exposure to rodents or contaminated places. This detail is very important because early recognition can help the medical team manage the case more effectively. The main message is that hantavirus is not a virus to ignore, but it is also not a reason for panic. The danger exists, but it is often limited and can be reduced through prevention, hygiene, rodent control, and quick action when concerning symptoms appear. As for vaccine development, it may become an important step in the future, especially if research receives enough funding and if scientists manage to design a vaccine that covers the most dangerous strains. Until then, awareness remains the strongest weapon. In the end, news about a hantavirus outbreak on a ship or anywhere else should push us to understand, not to fear. The virus is usually transmitted from rodents, not simply by passing near an infected person. And although some strains may spread in a limited way between humans, that does not mean we are facing a global pandemic. What we need is careful health monitoring, stronger research support, safe cleaning of places at risk of contamination, and special caution when traveling or entering spaces that may be neglected or filled with rodent traces. Knowledge here is not just information. It is a way to protect lives without exaggeration and without underestimating the danger.